This is Pet Life Radio. Let's talk pets.
This episode of Vet Candy is sponsored by Vetrimax, makers of Command Shampoo and Atopicreme HC 1% Hydrocortisone Leave-On Lotion. Learn more at VetrimaxProducts.com.
Episode of Vet Candy's podcast In Other News, a podcast to expand your idea of what is impacting the veterinary world, veterinarians, and all animal care professionals as humans. We are your co-hosts. I am Dr. Jen.
And I'm Dr. Jason Chatfield.
If you are not yet a Vet Candy subscriber,
why not?
Please subscribe for free today at myvetcandy.com. You can also reach me if you've got something wonderful to say at Jen at myvetcandy.com.
For all other things interesting and important, please reach me at Jason at myvetcandy.com.
Okay, Jason, so our topic today is veterinary dermatology.
Yeah, in other news, skin disease is still a thing.
It is a thing.
Huge thing.
It's a huge, well, I mean, pun not intended, right? Because you know what the biggest organ is in humans?
Well, and it's my heart for me. Right? Right. But I guess in general, I get it. It's skin, of course.
Skin, it's like our first line of defense against infection is skin, right?
Yeah, 100%.
I think everybody in this day now is familiar with the term PPE, personal protective equipment. And your first line of personal protective equipment is skin. It's your skin. So it's the same thing for pets. We don't have to be experts, do we?
Yeah, I was going to say I probably don't know. Let's be honest. Whatever you were going to say, I probably don't know.
Right, but
you know people who do.
That's right. You know what? We're Chatfields. We always know guys who know guys, don't we?
I do.
Yeah, so into the Candyverse today comes such an expert, Dr. Ashley Bourgeois. That's just fun to say.
Yeah, I kind of wanted to say it, right? And you have to be an expert.
I blame my husband. It's my married name. So
it is.
I had to tell all my clients how to say it when I switched.
Yes, and so do you parlez-vous? Parlez-vous français?
No, but funny story, when I got married, my husband's from St. Louis. And when I got married, when I switched my name and I decided to switch it clinically, all my clients were all excited. They're like, oh, did you meet this French man? I'm like, I'm a tall guy from St. Louis.
You're like, no, he's from St. Louis.
Wait, does that mean there's no French people in St. Louis? What does that mean? Of course you better bourgeois. What is that? Of course it's French, right?
It is. It's just not as exciting as people were hoping.
Right. I'm sorry, not cosmetology. The cosmopolitan area of the country known as St. Louis.
Right.
Fabulous. I love it. So first of all, you got to tell us where you went to vet school, although I have a strong guess.
Yeah, Missouri. I went to vet school, but ironically, my husband and I met when I was doing my residency in California.
Oh.
So it was the Missouri kind of connection that originally got us together, but we didn't meet there, which a lot of people always assume. So, yeah.
Tell the truth. Tell the truth. All right. You married him for his last name. You said Ashley Bourgeois sounds fantastic.
Well, so my
maiden name. She tried out a second date.
Yeah. My maiden name was Stitch. So a lot of people actually thought I should have kept my maiden name because I was a vet name. And I was like, well, if I was a surgeon,
that's right.
Maybe. But as a dermatologist, Stitch doesn't really help you very much.
No, shout out to Dr. Courtney Campbell, also a resident of the Candyverse. He wishes his last name would have been Stitch.
Yeah,
right?
I think he's talked about changing it legally, 100%.
Yeah.
Maybe a hyphenated name. I don't know. Courtney
Campbell Stitch. Yeah. Courtney Campbell Stitch.
I don't know if we're ever going to talk about dermatology, but, here we are.
We are. We're getting there. Okay. So you did your residency in California, which is interesting. And so then you became a dermatologist, and now you're located?
In Portland, Oregon.
Man,
you are been all over the place.
I know.
Military.
Oh, that's right.
Brat, so I'm used to it. But
you and Jack Reacher.
Yeah.
You think you're gonna stay in Portlandia? Don't they call it Portlandia?
They do. Yeah. We really love it. So that's the plan right now.
Yeah. And so don't they say like kind of like Austin, we're from Texas. And so one of the slogans is keep Austin weird. Don't they say keep Portland weird?
They do. Yep. It's up on some buildings and, there's definitely pockets downtown that have that vibe, but it's like anywhere else. Like there's tons of different people and it's really fun.
Yeah. And there's all kinds of people who own pets.
Yep.
Absolutely. Yeah. Okay. So we want to get into it today. And one of the things that I really like, actually, we're going to talk about some things I don't like to treat because they can be so frustrating for veterinarians. But actually, Jason, what do you think is the most frustrating thing for veterinarians with skin?
The most frustrating thing for veterinarians with skin, probably diagnosing it, right? Sometimes it's really, really difficult to diagnose it, and clients just hate it. It's gross. It's disgusting. They hate it. They're like, here, fix this and fix it with one shot. Let's go. I don't want to fix it. What do you mean it's going to take forever, right?
Right.
I think most skin problems boil down to allergy. I'm probably going to be corrected later on this podcast, but a lot of things take a while to figure out sometimes. So I think that's, client communication can be very difficult. So.
What's the most common thing you see, Dr. Bourgeois?
By far allergies and then the subsequent infections from it. So I think Jason's right on point. I mean.
Oh, come on now, Dr. Bourgeois.
Yes. Never happened on this ever. Right.
It's your first time in the Candyverse and you're already starting out.
Boom, I need a shirt. I was right.
Might be my last time, depending on
No.
Week after.
No, but he's right. So yeah, I mean, allergies by far are frustrating because they're chronic. And where he said client communication can be frustrating, that's actually what I love about it. And that doesn't mean it's not frustrating, but it's like a challenge of communicating with the client right off the bat. Mm-hmm. So first ear infection, first pyoderma, even though it could take us a while to figure out the diagnosis, setting their expectations right away helps so much with frustration.
Yeah, yes, because it didn't get that way overnight. Although it seems like all of a sudden pet
every single case overnight. I don't.
Yeah,
what are you seeing? Chronic cases are all overnight.
In practice, I see overnight. But what do you like? Do they tell you that it happened overnight, Dr. Bourgeois, or are they like fessing up that it's been going on for months?
No, I think because I am the tertiary care, either they're fussing up or they might say, oh, it's been a few months, but then I have the records. So they can say a few months. I'm like, 4 years ago, you were actually doing this.
What's
4
your
years ago?
Is that like 48 months ago?
Yeah, exactly.
So, so I live in the South. So, and I've practiced in Texas and in Florida predominantly on the Gulf Coast. And like when people come in with an itchy dog and the client inevitably tells me, I think he has allergies. And I say, great, what's he on for flea prevention? And they say, well, we don't have fleas. And I'm like, wow. Okay. Mm-hmm. So we're gonna start with, do you see many cases that the client thinks it's some kind of environmental allergen and it turns out that they're not on effective flea prevention? Or do you find that when it gets to you, it's truly some allergen?
Oh no, I see tons of cases that predominantly are flea allergy dermatitis all the time. And that comes to just being comfortable with distribution of lesions, history, asking the easy questions. I think sometimes people get nervous because people get really defensive about flea control, right?
Oh, yeah.
As soon as you mention it, if you kind of get nervous and back away right away, then it's easy to forego that and not really get them on that. I just warm up owners with saying, you want it to be flea allergy? You want it to be flea allergy, right? Instead of allergy has fixed that.
It's done. That is an overnight fix. Here you go, done. I'm hero.
Yeah, exactly. I'm like, there's not many things where you might only see me twice. So if it's flea allergy, let's figure that out and be done. But the other thing is even common atopics very commonly, we see atopy, so environmental allergies all the time. It's really common
for our news hounds who maybe aren't familiar with the term atopy,
sure.
Jen's quick and dirty definition of atopy is a dog or a cat that's allergic to the world.
I mean, when I took boards, that's not how I defined it, but I think that's probably fair. Environmental, and that could be, and I think, I'm okay with that, because a lot of times people think environmental, they think outside stuff, but it's tons of inside stuff.
Yeah. But feel no pressure, Dr. Bourgeois, just because I'm a co-host. Feel no pressure to agree and say my definition.
I already got slammed for agreeing with Jason.
So. No, you didn't get slammed. You got praised and set up on a pedestal. I don't know what you're talking about. You did a good thing there. Yeah,
that's right. Yeah, I think that's interesting that atopy, because I do think in general practice, atopy is something that practitioners struggle with incredibly. That, and then the other, like what we call weird stuff, like the pemphigus and all that. So, but yeah, so you still see pets that are not on flea prevention. And do you ever admit that you're not saying that their pet has fleas? You're just saying that maybe because this product, whatever, it is, but it has other side effects that are beneficial,
not just
for the skin. Because that's like my
blame, or blame the neighbors. Yeah, your dog doesn't have it, but you're next door to someone that has it. You got to treat for it. So sorry. Blame your neighbor.
So one thing I like to say is, now that we have some of the products, like the group of isoxazolines and all that, you can phrase it more as like ectoparasite control. Because you are then eliminating fleas, lice, mites, like all those ticks.
That's true.
That kind of helps. And I'll tell people, I don't see fleas. Like it helps. Yeah. They get guarded up. I'm like, listen, I don't see fleas. And actually, flea infestation has a completely different pattern of itch than flea allergy. Like flea allergy, you're just sensitive to any exposure, which a normal pet could care less of a few fleas jump on and jump off. So I tell them, hey, it's not infestation. And actually, that's not the pattern I'm seeing at all. They just might be sensitive to any exposure. And then slowly, sometimes you can start to see the client's guard come down a little bit. Also say, like, let's just commit to a few months. Like, give me a few months. Let's just make sure that's not the big problem.
And is it still, like, for some reason, it's in my head, and this is what I tell people, you got to do 3 months of effective flea control before you can determine that it wasn't fleas, right?
Yeah, I think that's definitely fair. Yeah, you definitely can't just do 1 month based on the population and their exposure. I think at least a couple, and I would agree at least 3 is really helpful to rule it out. And honestly, you're probably doing other things to make that pet comfortable in the meantime. Yeah. I also like to say it's prevention for a reason. Like, we want to prevent it. We don't want you to see an infestation and then we decide to use it.
Yeah. I try to put the fire out. That's also, Jason, if you see a pet that has like crazy hot spots or something like this, did you give him like a little pop of a short acting steroid?
I give them a card to the local dermatologist. That's what I do. I'm like, here, someone else take care of this. As much as I want to be hero, this is a mess. I don't want to deal with it. But did you just mention steroids and with a skin doctor on? I don't know. I'm gonna get her on my side. Like, no steroids. What's wrong with you?
No, but this is why I'm asking, because so they come to me, right, and the dog is chewing, and a lot of times it'll be at the base of the tail because somebody skipped a couple of months of flea prevention.
Or years.
Or years, they'll say, oh, I missed last month. And I'm looking like, we haven't purchased it from us in, 14 months. So anyway, so they've got this giant red raw spot. The belly's pink, like the pet's panting.
Are you setting yourself to be okay to give steroids? Are you setting yourself
I'm just
up
saying,
with this case?
I just give like a little pop of like a low dose, maybe half a mg per kg of a Dex SP, right? To put the fire out.
Yeah. What do you think about that?
What do you think? That's what I'm asking.
No, I don't want to answer that question. I'm asking the expert.
I feel like I'm in the middle of a sibling rivalry, and no matter what, I'm going to make someone an enemy.
You're not going to make me mad. You're
just
100% wrong.
You already got praised.
That's right.
So I don't hate it. I will say that for me, there's a couple things. Not every like quote unquote hot spot that comes in will be treated the same. That's the thing about dermatology. There's only so much stuff we have, but every patient's different. So one, of course, you get them on the prevention they need to be on. I would be checking infection, because if they come in and the area that they're bothering is just rip-roaring with bacteria, you honestly might just be able to treat them with either topical or systemic, depending on the case and severity. And
I do that. Absolutely.
Perfect.
Like my standard cocktail is the Dex shot to put the fire out today. And then I usually, if they're greasy and smelly, I clip and clean the wound.
Yep,
the
that's
hot
important.
spot, right? Got to get the gunk off. My favorite is Silvadene. What do you put on a hot spot for topical? Like if it's, what's your go-to, your first line empirical?
Yeah, so if we're just going to do topical, and again, it always depends, like I could always say that for derm, but I'll use even just a lot of chlorhexidine-based stuff to treat it. So even just clipping and cleaning it and using something like chlorhexidine, I do like silver sulfadiazine, so I'm doing that too.
Yes!
Yeah.
Yes!
Point for Jen.
Point for Jen.
Another point for you. That's Silvadine's great.
Jason, you already know that's my favorite. I love to frost the cake with Silvadine.
Yeah, yes. It's good. It's good for like ulcerative lesions too. Like they use SSD and like burns. So
yeah, no, exactly. And have you ever put it on yourself for a wound, like a cut or something? No? Oh my God! Instantly, it feels better. It's so soothing. And you put a Band-Aid on it overnight. You have no wound in the morning.
Done. Heals up.
Magic. It's magic. Although now I have heard there's some other stuff, like the technology, right, is improving. So I have heard of this. It's a cross-linked hyaluronic acid. It's like so it like provides a matrix.
That makes sense. Yeah, based on knowing like the skin and wound healing and all that, like hyaluronic acid and how it can help repair. I mean, it's just like a lot of facial creams too, right? Like
that's true.
Damage, like ceramides, hyaluronic acid. Like when you think about the stuff we put on our skin to help with wrinkles, or I mean, that's just biology of the skin. Same thing with animals, different products and pHs and stuff like that, but same idea.
So as we go to break, what I'm thinking is I need to get on the interweb and get me some skincare product with some hyaluronic acid in it. Perfect. You mentioned it's for wrinkles. Yes. So we'll be right back after a quick break. We got to pay some bills because I need to get some more skin cream. I mean, Mama's got to get some skin cream. Okay, we'll be right back, folks. Stick with us. On the other side, we're going to talk with Dr. Bourgeois a bit more about how to do the best things you can for your pet skincare.
Hello, this is Dr. Michael Rossi, a board-certified veterinary dermatologist in one of the largest and most diverse cities in America, Houston, Texas. As a specialized veterinary dermatologist, we have had owners and patients travel thousands of miles in search of expertise for skin conditions, including innumerable cases of atopic dermatitis. I often recommend Vetramax's Command Shampoo and Atopic Cream HC Leave-In Conditioner as part of the multimodal approach to managing atopic skin. Command Shampoo is backed by clinical research and helps to eliminate bacteria, including those resistant to methicillin. The Atopic Cream HC will help to soothe inflamed skin and helps restore the skin barrier's integrity. Plus, it's fragrance and dye-free. Learn more at VetramaxProducts.com or visit with your local board-certified veterinary dermatologist.
Oh, sure. It's all fun and games until someone ends up in a cone. That's right. We are animals. Deal with it. Pet Life Radio. Let's talk pets.
Let's talk pets.
Let's talk pets.
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
And we're back with Dr. Ashley Bourgeois, dermatologist extraordinaire, talking about skincare for your pet. So we kind of hit on allergies a little bit, and we did talk about atopy some and the hot spot, because I got to say that's like the most common thing, and flea prevention. But the ears, right? Because you guys treat ears, don't you?
A lot of ears.
A lot of ears. Okay, and I got to tell you, like my standards, do you give them a little pop of the big anti-inflammatory gun? No?
Again, it depends, right? So if I
did a political answer, what she means by that is no, that's absolutely wrong. What you're doing.
Not at all. So that's not at all.
That's what you said. That's what you said off air. You told me. What are you talking about? No? Okay. No. Totally kidding, Kenny.
Back it up.
Never said that.
There's a reason I say it depends a lot, and that's because if you make a statement, everyone thinks, oh, every ear case I'm going to treat like this.
Yes.
So if I have just hey, I'm doing great on whatever my allergy protocol is. If I have a patient who's on immunotherapy and an occasional oclocidinib, and they get a little yeast otitis, I'm really just going to treat it topically and recheck them and make sure they respond. If I get that Cocker Spaniel,
you went there.
and I can't even get the scope in the ear, then I am going to put them on some corticosteroids. I tend to put them on orals personally.
Right? Like a little pred? Do you do prednisone?
Yeah, managing them long term. We're kind of, what are we going to do in the future? So that's why I say it depends. I don't hate that answer, but I don't believe every otitis needs steroids systemically, depending on the severity.
Yeah, and I guess I do it for a couple reasons. Is I do like the oral stuff if it's a dog that's so severe that I can't even lift the ear up without the growl and the anger, and I'm worried about an oral hematoma forming. And so for those of you in the Candyverse who may not know, I didn't say oral, I said oral. Did you hear that difference, Jason?
I did.
Oral. Yeah, it means, like when the hanging down portion of their ear puffs up like a pillow, and you got to drain it because they've been flopping their head. So those ones, if I'm worried about it, I will put them on an oral steroid because I can control the dose, and really titrate it. But if it's one that, the dog gets chronic stuff, so the client's in early because they've seen it before and the dog's already flopping, then I might pop a little shot with a little Dex SP.
Yeah, you got to put the fire out before you can treat it.
Yeah, I like that. So the one thing I will say is when you talk about steroids, you keep seeing Dex SP. So I do like that. No, I like that because it's short acting, right?
It's short acting. That's right.
Versus always relying on something like a long acting steroid and they're just getting that every few months and then all of a sudden and there's problems. No. So you're talking about just a short course and a very short acting steroid. So that's good.
Yeah, just putting the fire out today because then my other treatments will have time to work and it'll be easier for the client to clean those ears out or put medication in that night and the next day, right? Before it really gets to action. So that's one. So we're not doing the pet a disservice.
Correct.
I guess by using a short acting one because I'm telling you, otitis, man, is huge.
Yeah.
Otitis is a big deal. So at what point do we refer? I mean, Jason said he's petrified of skin cases.
I didn't say petrified.
I heard petrified.
I just said I don't want to deal with it because it's gross, so go over there, right? Ashley went to a lot of school to treat these things. Okay, she should treat it. So there you go. Never said petrified.
Well, I mean, I'm thinking, what are you going to do when we get really gross stuff on the podcast like eyeballs or something?
I'm going to send them to Courtney Campbell so we can put them back in.
No!
You take them out.
Yeah, I just send everything out. It's great. It's fantastic.
Yeah, Jason, he serves as a hub.
Yeah,
for distribution of veterinary cases.
I think it's a gig for me. That's for sure.
Ooh, it's a side hustle. So so what is like kind of your favorite dermatology thing to walk through the door where you're like, oh, that looks so exciting?
I actually do love ears and I have to love allergies because that's the majority of what I deal with. If I like the thing that gets me really excited, probably the two things that get me really excited just because I don't get to see them as often and you can look from awful to amazing very quickly are mites. So I love a good Demodex because I can look like a hero very quickly.
Right. I was going to say, if that were my question, I would say mites because you actually literally almost overnight. Hero.
Yeah, they just do so amazing. And I love a good autoimmune. Like when their nose is falling off and then within a month or two, like they have a nose back. Like it's a pretty cool feeling, even though they can be frustrating. Like it's a good mix up to the day.
So then at what point should I, as a general practitioner, really, or even as a pet owner, because a referral is generally not required for dermatology. Like you can go to a specialist with your pet. It's better to have a referral. But as a pet owner, when should I start kind of expecting that referral? And as a general practitioner, when should I really be thinking I should refer this? Kind of, where's that line?
Yeah, and it will be different depending on the comfort of that general practitioner because there's general practitioners who do amazing dermatology and they might not have a dermatologist they can refer to. In general, I think it's recurrence in the chronicity. Like if it's to the point where you feel like there's just ear infections happening and they're starting to happen more and more and closer together, getting ahead of those cases with things like allergy testing and getting the underlying cause figured out can save you a lot of time, frustration, and money rather than dealing with it. And then you have a horrific, pseudomonas otitis that really does have to see a surgeon to get the ear taken out.
Oh,
yeah. So really when they start, I feel like when the infections start happening more and more closer together, or if you have an owner that's really proactive, like I've had pets referred to me after like 2 ear infections because the owner's like, I want to know right now what the pet's allergic to and get ahead of this. Then you will be your dermatologist's best friend if you get these cases to them early.
Wow.
Yeah, those are my
Interesting.
favorite. When they come in and they're amazing, but they just want an allergy test. I'm like,
Yeah. You're
my
like,
dream.
what's up?
Yeah.
That's awesome. That's
Yeah.
awesome. So what is your kind of, do you think that general practitioners, should we be doing ear cytology on every single like suspect ear infection?
I could preach the importance of cytology in anything skin and ears day in and day out.
Oh,
Almost every case, unless it's I'm doing amazing, I'm just here for my blood work case, I'm pulling a slide out. So I look at
wow.
every single ear and almost every single skin lesion under the microscope.
Uh-huh.
Because even if it's not that bad and they respond, like I judge when to stop my treatments, I judge what we need to do for maintenance long-term based on even that follow-up cytology. So yeah, I look under the microscope for almost every case.
Wow. Jason, how about you?
How about me? What exactly is the question here?
He doesn't see cases. He just,
I
He
just
just
send
refers
them
them
on.
out. He refers them out, right?
Oh,
So-
I mean, I just say that to be funny, but ear deals and skin deals, I think every veterinarian, every general practitioner is going to try to treat it at least once, because you got to try. You have to try. Otherwise, A, you feel like a failure. Let's be honest. It's what you're there for. And B, something maybe you can do. So I think that when to refer is how busy you are, how much time you can give, and what your resources are. Like if I'm out in West Texas, I don't really have the ability to refer, except maybe with the fancy word we use nowadays, a telemedicine situation. Maybe we can kind of use that as a tool. Are you getting more and more of that these days with like, hey, here's a picture of this. I got a client 80,000 miles away. What is that, like 5 times on the earth? Anyways, can you help out and just have a picture, or how does that work for
it's like
specialist?
if you're, are you treating a Mandalorian or something?
Yeah, Mandalorian. Baby Yoda. Baby Yoda's got an ear infection.
Baby Yoda for an ear infection.
He could, right? That'd be terrible, right?
Yeah.
I'd send him to you, Ashley, for sure. Hey,
yeah. So do you guys
I'm
have
going to make the
telemedicine?
cover of some magazine if I get to treat Baby Yoda.
Oh yeah. But so do you guys use telemedicine in your practice, or like is it effective?
Yeah, so we are using telemedicine. Right now, we're mostly doing like clients. Listen, telemedicine doesn't replace seeing a patient in person. Like you have to know that as an expectation.
Yeah.
But we are having some cases just for various reasons where we will do telemedicine, and sometimes the telemedicine just becomes a conversation of how it is that important for the patient to get in the door. We are very soon, my company in particular, we're going to start doing telemedicine to other veterinarians. So just like you mentioned, there's states without dermatologists.
Yeah.
Right? So, So opening up the door to things like that will be really important. And I think Jason actually hit, unfortunately, another really good point.
Come on.
I know. Well, you have good points too, but I feel like we need to give him some.
Thank you.
He's having a magical day.
Yes, magical.
I just have to be asked back, so I'll pump you up later too. No, I think it really does become on the comfort of the general practitioner as far as treating and how long they're going to deal with it, and then the resources that they have.
Yeah.
So, in the client's expectations, some people will not go see a specialist.
Uh-huh.
They just won't see another doctor.
Do you think that's price? Like, because, I mean, I don't think dermatologists are, super pricey for your pet, right?
I think compared to someone like a surgeon, like that visit and that procedure is not going to be expensive, but
it's a little longer.
The surgeon will probably see them twice.
Right.
Yeah. Whereas if you're following up with me for 10 years of your dog's life, like over time, that can get expensive. I think it can come down to price. I can also think it just comes down to some people just totally trust their vet. Like they have found that relationship and they're stuck with their vet. And one thing I can say for general practitioners too is if you really feel like that patient should be referred, don't give up recommending the referral over and over again, like just because one time they said no. Because I've had several where I see in the record, like derm referral declined. And after saying it over and over again, they finally go for it.
Wow.
So listen, as a specialist, do you ever have to, this is way out of the topic here, but I'm just thinking, which doesn't happen very often, so I kind of jump on it. So
Hold the phone in the Candyverse. Jason has a thought.
Don't break it. I'm going to lose. I may have lost that thought. I have one thought a day and I may have just lost it. Listen, do you find yourself walking the line like, my veterinarian couldn't figure this out. I got to come see you. Why do I go to this guy anyways? That kind of deal with, some, I don't want to say older, but different generation of maybe the younger animal owners probably like, oh, no problem. I go to specialist. That's actually really good medicine.
Yeah.
Whereas a different generation is like, oh, this is terrible medicine. My GP should just be able to fix the whole world. Do you have to deal with that a lot?
Yeah, sometimes. And I always have respect for my primary veterinarians because, they are the ones seeing these cases frontline. And so what I always tell owners when they start bringing that up or like why I've been dealing with this for 4 years and they couldn't fix it is one, I only do derm. Like, that's it. Like, that's what I see day in and day out. And so it's easy for me to see something and say, oh, I think we should biopsy. Oh, I think we should do this. But I tell them, I don't have hit by cars running, rushed in the clinic behind me. I'm not also dealing with, I wouldn't even know the first line anymore for like a seizuring dog. So it's just all that you do, then that's very different than having to manage all of those things.
Good point. So I do think that is an issue. Sometimes the practitioners don't refer soon enough because they're concerned about losing a client. I mean, that's a legitimate concern, and what is being said to them on the other end. I really doubt a lot of people are saying bad things, but still, that's something to be brought up for sure. So by the way, Jen's first line defense for hit by car is Dex SP.
Yes. But it's not my first line empirical treatment for a cardiac case, just so you know. That would be Lasix.
Okay.
And if Alan Spear is listening, he is laughing right now. So it's interesting how telemedicine is coming about in the last year or so, right?
Yeah.
Accelerating. I think that's fantastic, especially for skin because there's so many rechecks. And so I think you're right. Like, we got to have that initial establishment, and maybe some cases you have to see back every time,
I think that, absolutely. And I think to go to your guys' point about the general practitioner, like if you have specialists in your areas, get to know them. Because also what can be really helpful is having that relationship with them and set up the expectation. I have some referring vets who send them to me and they basically want to wipe their hands clean. And they're like, you manage it. Like, I don't, like they don't want to do
that. That would be me. Yeah, I don't want to ever see it again. Call me when it's better.
Yeah, they're like, you do it all. Like, I will have one of my clients, like, they flare with an ear infection. They'll go to their primary vet. They're like, no. Like, you're supposed to go to the dermatologist for that. But then there's some that they will maybe send them to me for allergy testing, but there's some portion that they still want to be involved. So when you kind of get to know your specialist and can set up that expectation, then it's just better for everybody and better for the patients, which is most important.
Do you call that like happy hour with your friends in dermatology?
Oh, I would love to do that. I'm always about a happy hour, especially with young kids at home. Happy hour.
I was just going to say, not only are you dermatologist extraordinaire in Portlandia, you're a mom. You've got 2 kids.
Yeah, my 3-year-old I can hear wants to come through the door soon. Yeah, I have a 1-year-old son and a 3-year-old daughter. So they.
Oh my God!
Listening.
Not just kids, little
they're
ones.
Babies. They're so little. Oh my gosh.
Well, to be fair, they're both like 99th percentile in height and weight. So they're
so they're like really a 4-year-old, right?
Right. Yeah. Well, literally, my 3-year-old wears 5T, and
my
1-year-old is in 2T.
Whoa! And so you have a lot of strength and energy.
I try. It depends on the day, but I certainly try my best.
I'm thinking that is because you are are you a physical trainer, a personal trainer, or a coach or something?
Yeah, so kind of like an online health coach. A lot of other veterinarians are kind of in a group. It's more set up as like an accountability group. But we have certain workouts and certain healthy things we try to do and just support each other. As you guys know, there's a lot of parents in there, but there's a lot of single vets too. And no matter what, we all have our reasons that life gets crazy and it's easy not to take care of ourselves. So
there's not much better accountability than peer accountability for sure.
Oh my goodness.
Totally.
For sure.
Yeah,
so you just get on a video chat and be like, Tom, you didn't work out last week. You're terrible. You're booted out.
So that's not how I handle it.
That's exactly how I would do it, right? 100%.
I may be a little bit more empathetic.
Right.
No, it's more just like a group of people where if someone hasn't, we'll just like check in. Some people will do video call workouts together. But if we haven't seen someone for a while, it might be like, hey, just what's going on? Like we all get crazy times in life that take over. So I can't say I'm going to take your approach, Jason.
100%. I would take that approach. I'd be like, Tom, you got one more chance and you're out, man. You're bringing the team down.
You're bringing the team down.
The same people that I would.
Oh my gosh, that's crazy. That's crazy. Yeah. So, Jason, do you have any other burning derm questions, or can we move to
a game?
Busting derm myths.
Oh no, I had another question, but that sounds way better. Let's do that.
Okay. So
did you really have another question?
Well, look at you calling me out. So I did. But it was a long question. We'll get to it maybe on another podcast. I want to play Busting Derm Myths. That's very exciting to me.
All right, so this is kind of along the lines of like crazy stuff that clients have said, right? And a lot of them follow the phrase, I read on the internet. Right? Okay. Yes. So, like I have a shampoo that I really like to recommend. I love it for healthy skin, right? Like just for routine bathing or whatever. And so people will say, oh, no, I just use like my shampoo on my dog because it's high end and I get it at the salon. So it's okay to use human shampoo on pets?
So in general, we usually recommend not to, just because there's different pHs of the skin for dogs and cats compared to people. There are certain situations where we might use like one or two human products, but usually because the pH is different, we don't recommend that like as a general statement.
Yeah. Okay. So that's a myth. What about Dawn dish soap?
Yeah. So if you're degreasing a pet,
it cuts the grease.
Degreasing it, like not like, oh, you're like kind of oily, but like, we have certain cases where they're just like you touch their fur and like your hand slips off. Then we will use actually Dawn dish soap sometimes to degrease, but usually not long term. Usually it's more kind of getting through whatever's causing that and then switching. But you can in some cases use that to degrease, yes.
Yes.
Well, listen, I'm going to get to this because I know Dr. Jen's going to get to it because living on the farm, I know she's had it. But I worked for a bit in, let's say, a less than metropolis area once or twice. Mm-hmm. And I worked with some really good people, but they had old school sort of thoughts.
Yes.
And their dogs come in with this dermatological problem, and it was obviously mange, right? Not obviously mange, but hey, it's my first thought. And so they said, listen, doc, I got some extra motor oil. It's okay, right? I'm going to go ahead and put it. It worked on my last dog.
Used. It has to have already gone through the car.
Yeah, well, okay.
Oh, geez.
Yeah, but I'm not kidding. Like, that's a real thing. So I need some expert to tell me that that's true or not. I don't mean Jen. I mean you.
No. Yeah, I'm going to go with don't use motor oil on.
No? What?
Listen, I'm going to throw that out there. I know it sounds crazy.
Right?
Yeah.
I know.
Especially used and hot. Yeah, no, let's not do that.
Okay, no motor oil on Fido. Okay, gotcha.
Got it.
Down some places.
So here's another thing. People think that you should clean your pet's ears out every day with a Q-tip.
Right. I would not. No, because the concern is, so dogs and then cats to some degree have an L-shaped ear canal. So if you go to just clean, like we sample for infection with a long Q-tip, but when you're talking about just cleaning it out, you're really risking pushing stuff from the vertical canal into the horizontal canal and just kind of trapping it in there. So that's why we usually recommend flushes, because then it can get all the way deep into the ear canal. So I would definitely say do not use Q-tips with the purpose of cleaning out animal ears.
Yes. So I think that's fantastic. So I'm going to ask you about a specific thing that clients always come in and say. They use like a homemade ear flush, like a vinegar.
Yeah.
And I'm like, I usually look at them and say, would you put that in your ear? And the problem is that some of them would.
Yeah.
Probably. Yeah.
Yeah. Or they dump alcohol in the pet's ear.
Yeah. Ouch. Ouch, right?
Yeah.
So there's some vinegar solutions like 50-50 if they just had a little yeast that actually could be effective. The problem is if you're just making homemade products and you're not having a veterinarian actually examine the ear and look down, you can't be sure that eardrum's intact.
Oh.
And then you're talking about putting something like really acidic like vinegar, right? Like getting into the middle ear where like your balance apparatuses or where your hearing apparatuses, like middle ear's right next to all those things.
Yeah.
So you're really careful about that kind of stuff. So
that's why you'll find out right away if it's intact. So.
I think, you'll find out right away.
Right.
Okay.
Not saying that's a good test, but
No. So, Jason, do you have any other myths that we need to bust?
not a myth, but it's okay to get my dog's ear wet. I should never get my dog's ear wet, right? That going on the L-shaped canal thing. Can I get my dog's ear wet? Can I go swimming? Is it bad? Is it terrible?
Yeah, they can go swimming. And in a normal dog, they have little cilia in their ear that bring things up, and it'll dry on its own. But you can have different conformations, different lengthenings of ear canals. So if that is a cause of concern to cause ear infections, then you just need to get a product from your vet as far as helping to clean them when they're done. But my philosophy is dogs should be dogs. It's our job to manage them to be able to do these things that they should be able to do, like swimming and running and weeds.
I love that. Dogs should be dogs.
Yeah.
Even Cocker Spaniels.
Even Cocker Spaniels. Yeah. When we allergy test, that's what I tell owners. They always think, oh my gosh, they're allergic to 20 things, like
grass.
What are you gonna do? Like they can't go outside to go in the grass to go to the bathroom. I'm like, no. Dogs should be dogs. My job is to figure out what works for your dog so that they can live that normal life.
Oh my gosh, that's such a lovely sentiment. I think we're ending today's lovely podcast with that. Dogs should be dogs. And it's all of our job to help them be able to live that normal, healthy life, right?
Absolutely.
Oh, I
That's
love
what
it.
I'm here for.
Oh, I love it. I love it. So, Ashley, Dr. Bourgeois, can you tell us how people can connect with you? Because I think you have a podcast of your own.
I do. Thank you.
What?
Yeah. So I know it's something that I kind of my whole passion is just to teach derm to veterinarians and just in a fun, digestible, easy way with our crazy lives, which is very similar to what you guys are doing, getting this great information out there. So I do have a podcast. It's called the Derm Vet Podcast. I don't make things very complicated.
Is it on? You can find it on iTunes, right?
iTunes, Spotify, like all the major ones.
Yeah, she's big time. She's everywhere.
I know. And is this for is it for vets or pet owners or both, or who's it for?
Mostly for veterinarians. So
okay.
What it's kind of turned into is having other dermatologists. I recently had a neurologist on, like just talking about common derm ear issues.
Oh, that's
I'll tell you what, I'll get one of them cowboys on. They'll call you up. You guys can have a whole podcast about the benefits of motor oil on a dog, right?
Wait, you're not saying it right. It's motor oil.
Whatever. Motor oil.
I'll put them some used motor oil, and I can say it because that's how I say oil.
Yeah.
I say oil. Anyway, that's so fabulous. So, folks, if you want to find Dr. Ashley Bourgeois while she's out in Portlandia and you don't want to travel the Pacific Northwest, you can find her on iTunes or Spotify on the Derm Vet Podcast. Or you can find her sometimes visiting the Candyverse here with us on in other news. So this has been a wonderful discussion about derm. Thank you so much, Dr. Bourgeois, for joining us.
I'm sure she's got a website. What's the website? Is there a website we can go see that?
Oh, you guys are like spying on me. Yeah, so I'm on, I have a website just recently launched. I'm kind of formulating, it's thedermvet.com, and I'm on Instagram and Facebook as the Derm Vet. So it's all the Derm Vet.
Whoa, she loves her some dog and cat skin. Okay, right. So we'll put this in the episode notes for this podcast, and you guys should do two things today. If you're not already following Vet Candy on the socials, myvetcandy.com, at myvetcandy. Then you should also follow the Derm Vet, right? What is it? At the Derm Vet or at Derm Vet?
The Derm Vet. Yep, at the Derm Vet. Yep. At
the Derm Vet. Beautiful. And the dermvet.com. So, Dr. Ashley Bourgeois, educating us up on dermatology. I'm Dr. Jen.
And I'm Dr. Jason.
And thanks so much for joining us on this episode of In Other News.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.